The Region 6 COVID-19 Task Force met and discussed the COVID-19 situation last Tuesday. Renetta Court reports.
The Region 6 COVID-19 Task Force met on Tuesday, January 26, at the Regional Democratic Council's boardroom to report and discuss the effects of the pandemic upon the region. During her report, Regional Health Officer Dr. Vishalya Sharma gave an update on the spread of the virus during the month of January. In her report, Sharma noted that so far, 469 tests were conducted, with 370 negatives and 99 positives. Out of the 99 positive cases, 65 are active, with 14 recoveries and 2 deaths.
New Amsterdam was initially our challenge because we would have had majority of cases. We would have had as much as 34 active cases at one point in New Amsterdam, but we're happy to report that has reduced to 17 actives. Majority of our patients have recovered. Unfortunately, we would have had 1 death during the past 2 weeks, and of course it's coming from the New Amsterdam catchment area. Oriala, what we're having is a second wave, and we would have 22 cases as of today, with Siparuta 5. So in total, Oriala and Siparuta now gives us 27 active cases within the 2 communities. Fort Ordnance, Kanji 3. Kanji was also considered one of our hotspots at one point in time. So now we're at 3 actives in Kanji. Edinburgh, I can recall from the first spike, has always been one of the areas we're looking at. Port Moran, Quarantine 2. Glasgow 2, Stanleytown 1. We have the village 71, 76, 1. Smithfield, and for the first time, let's be going at Blackbush area, we have a case there.
She later highlighted the challenges medical officials have been facing following the second wave of cases in Oriala and Siparuta.
Our challenge with Oriala remains the same. Compliance, the enforcement, and now this time that we're going in, one of our concerns is the resistance of the community. They're not as well receptive or welcoming as the first time. But we've been working through the challenges in terms of getting them tested.
Plans are already established to work towards containing the spread of the virus.
We're looking at Florida going into another team headed into Oriala, Mr. Armstrong. We're also looking to expand some additional testing, especially in the areas that weren't that we didn't consider, for example, Blackbush, now that we have a case there. And we're hoping for this remainder of the week to continue surveillance, continue testing. We're hoping to spend some time this week on Fort Kanji Hospital to reinforce the guidelines there, as well as continuous in training at New Amsterdam and restarting our elective listing so we can clear our patients.
Regional Chairman Mr. David Armagon then stated that in order for us to curb the spread of the virus, we must all follow protocols.
We now have to take special measures to make sure that we can bring this curve down and hopefully flatten it so that by the next 14 to 20 days our situation can change drastically, whereby we will not have too many cases in the region.
He further emphasized,
The Minister of Health has made it very clear, and I think we all know this, that if we have a very high number of cases, we don't have the capacity in our health system to handle a very, very serious epidemic. So, we all have to be careful.
Therefore, the general public is urged to adhere to all COVID-19 health measures so as to protect themselves and others from the COVID-19 pandemic. Reporting for Channel 8 News, Renetta Court.